All right, let's get right into it. Something massive is changing about the way we find information online. We're talking about a total rewrite of the playbook, and to really get it, we're going to zoom in on a super high-stakes example, UK healthcare. But trust me, what's happening here? It's coming for absolutely everyone. So picture this. It's 2026. Someone in London needs a cardiologist. They pull out their phone, they ask a question. But what they see next is totally different from anything we're used to. Instead of that classic page of 10 blue links we've known for decades, they just get a paragraph, a single, summarized, definitive answer that recommends maybe 2 or 3 specific doctors. Now, if you're not in that paragraph, you're basically invisible. This is the new reality of search. And look, don't think for a second this is some sci-fi stuff happening years from now. A recent survey found that nearly 1 in 4 UK patients, that's 24%, are already using AI for health advice. The shift is happening right now, and it is moving fast. The game has already changed. So, this brings us to our first huge idea, the AI as the new gatekeeper. The AI isn't just a tool to find websites anymore. It's the new front door to information itself. And if you don't have the key to that door, you're not getting in. And this AI gatekeeper, it's incredibly strict, especially when it comes to what Google calls your money or your life topics. You know, things like health, finance, safety, where bad info can have really serious consequences. AI is now taking that scrutiny to a whole new level, demanding deep, verifiable proof of trust before it will even think about quoting you. So how in the world do you earn that trust? Well, it means you have to understand the difference between the old playbook and the new one. The old rules were all about search engine optimization, or SEO. The new rules, that's a whole different ballgame. So in this new world, the goal isn't to just rank number 1 in a list. It's to be cited in the AI's answer. The signals have completely changed. It's less about keywords and more about things like entities, authority, and sentiment. And for healthcare in the UK, it's not just about some generic website authority score anymore. The AI is looking for real-world credentials, like your CQC registration or a doctor's GMC affiliation. And this new practice, it has a name, Generative Engine Optimisation, or GEO. And let's be clear, this is not about trying to trick an algorithm. It's the very deliberate work of making sure an AI can understand exactly who you are, what you're an expert in, and why you are trustworthy enough to be used as a source. Now, if you're sitting there thinking, I'm good, I already rank at the top of Google, you really need to see this number. It's staggering. 62% of the citations in Google's AI answers come from sources that are not on the first page of the traditional search results. Let that sink in. Your SEO rank and your AI citation are now 2 completely separate things, and they need 2 separate strategies. I absolutely love this quote because it just nails it. GEO isn't some technical hack. It's about taking the real-world reputation and authority that you've already built and translating it into a language the AI can understand. It's about making your expertise digitally obvious. Okay, so that's the what and the why. Now let's get to the good stuff, the how. How do you actually do this? Well, there's a new playbook for visibility, and it's built on 3 core strategies. These are your 3 pillars of GEO. First, you build your entities. Second, you create these deep content hubs. And third, you have to actively manage your reputation across the web. Let's break each of those down. All right, strategy number 1 is the foundation for everything. An entity is just a fancy word for a real-world thing the AI can recognize, like a specific doctor, a medical condition, or a hospital. If the AI doesn't recognize your experts as credible real-world entities, it has 0 reason to ever recommend them. So, how do you build one? Well, it's not a headshot and a 3-sentence bio. We're talking about deep, long-form profiles, over 600 words, with full credentials, like a GMC number. It also means using something called schema markup, which is basically code that labels all the information on your page so the AI can understand it perfectly. And everything has to be accurate, matching public records exactly. Next up, strategy 2, content hubs. You can pretty much forget about those short little blog posts stuffed with keywords. The AI is looking for truly comprehensive, authoritative sources. This means building these deep hubs of content all about one core topic, and then surrounding it with pages that answer every single patient question you can imagine, with real clinical depth. And finally, strategy 3, which might just be the most important and most overlooked. With GEO, you have to pay just as much attention to what other people are saying about you online. The AI reads everything: your Google reviews, conversations on Reddit, your Trustpilot score, even what your employees say on Glassdoor. It's building a complete picture of you, and if that outside story doesn't match what you say on your own site, the AI is going to trust the crowd. Okay, I know this can all sound a bit theoretical, so let's look at a real-world example. There was a private hospital group in the UK. They were doing great in traditional search, but they were totally invisible in AI answers. So they ran a focused 8-week sprint. And their sprint followed these 3 strategies to a T. The first 2 weeks, all about auditing and building out those clinician entity pages. The next 4 weeks were spent creating really deep content hubs for their main specialties. And the final 2 weeks were all about managing that offsite reputation. So what happened? I mean, this is what it's all about, right? By week 12, the results were undeniable. The hospital group started showing up in the AI's answers for 6 of their most important, high-value searches. They became a trusted, citable source. It proved this whole approach actually works. So to help you get started, here's a quick checklist you can use right now. Think of it as your immediate action plan. Does each of your experts have their own detailed page? Are you using the right kind of structured data? Is your Google business profile actually complete and up to date? Any box you can't check here, well, that's where you need to start. Okay, so we've gone really deep into healthcare, and for good reason, but now it's time to zoom out. Because the principles we've been talking about are not just for clinics and hospitals. This is about the future of how anyone gets found online. Period. Seriously, it doesn't matter if you're a financial advisor, a software company, a local plumber, or an expert in your field. The AI is going to be asking the exact same questions about you. Are you a known entity? Is your content truly authoritative? And what does the rest of the internet have to say about you? So here's the big takeaway. The very infrastructure of the internet is being rebuilt on this new foundation of entities, authority, and trust. The old tricks just aren't going to cut it anymore. The future belongs to those who can prove their real-world expertise in a way an AI can understand and verify. And GEO, that's just the name for doing that work. So I'll leave you with this one question to really think about. As we move from an internet of links to an internet of answers, the only thing that's going to matter is being the source the AI trusts. So the question you have to ask yourself is this: how will the AI know to cite you?